Hyperbarics, and we are back with Chad. Chad has just completed 26 dives.
Yes, ma'am.
26 treatments, hyperbaric oxygen therapy.
Yes, ma'am.
So the last time we talked, you had mentioned, the last video we did, you only had 5 treatments.
Yes, ma'am.
And those 5 treatments, you saw a big difference in stretching and your headaches
Yes,
and
ma'am.
bladder issues.
Yes, ma'am.
How are things now that you've had 26 treatments?
They're better. I'm still not 100%,
Right.
but they're steadily increasing. As far as healing, I would say. The stretching and the joints and stuff, to me, they've limbered up. I still have, not bad days, but I still have stiffer days here and there. But I go to a chiropractor twice a week, and with that, he saw me day before yesterday and said it was the best adjustment that he's had so far, and I've been seeing him now for about 2 months.
Good.
So that says to me that the chamber is working and allowing my joints to be, I guess, be more properly aligned.
Cool.
So
Very
he can
good.
adjust them.
Now, this chiropractor is also doing acupuncture, is that
Yes,
correct?
ma'am. Yes,
Does he have any comments about the acupuncture?
Well, I had some irritation going on my hands from what I think was medicine related, and it had caused my hands to severely crack open. And he said that he noticed that my hands had healed, and he said that along with the chamber, that acupuncture also is known to help skin irritations. So he wasn't for sure as of to which to give a credit to, whether it be the chamber or to the acupuncture. But it's definitely worked. As you can tell,
Yes,
I don't have
that's
any
awesome.
don't have any problems on my hands like I did. But
Very cool.
yes, ma'am.
Well, good. And also, you're doing physical therapy. So have your physical therapist said anything to you since you've been coming to Hyperbarics?
They've asked a lot of questions as far as do I see any difference? The one, I'm doing physical therapy on my lower back at the chiropractor, and I'm doing physical therapy at Triangle Orthopedics on my shoulder, shoulders rather, but they're concentrating more on my left shoulder than my right. And I've got a bicep tendon that's been damaged, and it's one of those things that I'm feeling from talking to them and the chiropractor that only surgery is going to fix from that. But as for the overall strengthening in my lower back and the overall strengthening in my shoulders, other than that issue, it seems to have helped me. I can personally notice the difference where others necessarily can't because they're not in my skin.
So. Right. So now you are one of our workers' comp cases, and your injury was a car accident on the job.
Yes,
okay?
ma'am.
And this happened in 2013.
June the 8th of 2013.
So is this the best you've felt so far?
Yes, ma'am.
Okay.
When he adjusted me, today is Friday the 5th, is that correct? When he adjusted me on Wednesday the 3rd, or was it?
Today's the 4th.
Today's the 4th.
Today's
okay.
the 4th, yes.
So it was
the 2nd.
The 2nd that he adjusted me. I'm more relaxed. I'm dealing with PTSD along with a traumatic brain injury, which the chamber has seemed to help me to relax more. It's caused me not to be as hostile. It's not, or not necessarily, I guess hostile is a bad word to use. Not as irritable, not as agitated. I don't feel like the room's closing in on me when a bunch of people get around like it did before. And it gives me an overall sense of relaxation. So when I go in there and I'm in the office for an adjustment, I relax a lot more. And when he does adjust me, it's not like he's having to force it. He just does it. And this last time, there were multiple vertebrae that you could feel the gas releasing in the vertebrae, and before it's only been like one pop, and this time it was like multiple pops at one time. It was a very good feeling, and I was happy to have felt it.
Good, good. Well, and you also are seeing Gina Alex at a Peace of Mind Therapy, and
Yes.
she's doing the EMDR, is that correct?
Yes, ma'am.
How is that working for you?
I'm enjoying that as well. It's helping me to cope with the PTSD and traumatic brain injury as well. My speech has gotten a lot better. The only time I really have an issue with my speech is when I get nervous or stressed, and I notice that my speech I start to get a little bit of a lisp and a little bit of a stutter, and my speech gets a little slower than normal. But the EMDR, it's a 3-part system. It does sound, it does a feel, and it does visual. The sensors in your palms, they vibrate, and they also emit a light, and they have the headphones that emit the sound.
Nice.
And the 3-part system together seems to help me a lot. It's very relaxing. It takes you, it's kind of like the old Calgon commercial, Calgon take me away. It's more like EMDR, take me away.
Yeah, yeah.
And it works really well. I've only been doing the EMDR for, I would say 2 or 3 or 3 or 4 times.
Okay.
We've been doing a lot of talk therapy.
Good, good.
Prior to that.
So a lot, they say that hyperbaric oxygen therapy is an adjunct therapy. So you've got a diagnosis of TBI and PTSD, and you have had an array of different types of therapy, including the hyperbaric. So you've had physical therapy and chiropractic services, acupuncture, talk therapy, and your EMDR.
Yes, ma'am.
Along with your hyperbarics.
Yes, ma'am.
And that package seems to be working for you.
Yes, ma'am, it does. I would say that the hyperbarics has been nothing but essential.
Okay.
It's been essential to the other therapies. It's
because you had the other therapies before you had the hyperbarics, and you really haven't seen the okay, I see what you're saying.
Yes, ma'am. It's kind of like having cereal with no milk.
Okay.
I mean, without the hyperbaric chamber, I don't think I'd be as far along as I am now. I believe that it's helping me. Like I say, I still have days that aren't as good as I'd like them to be, but overall, the days are better and better each day. Each dive seems to be better and better. The headaches are slowly getting better to where they're not as frequent. Other issues are getting better.
Good.
I'm one of those people who are very right now. I want it right now.
Yeah, we all do.
So this has taught me patience and having to wait for the body to heal versus it healing immediately.
Yeah. Well, you have a prescription for 40. You're at 26 dives, so you got a little bit more to go here.
Yes,
so we're excited to see where you're going to be at that 40 mark. Of course, we love having you here, and I'm sure you like being here.
I love being here.
All right.
I'm relaxed every time I come, and I'm relaxed every time I leave.
Good.
And you guys have been very flexible around my schedule with all the other doctor's appointments that I go to.
Well, good. Well, we love having you here, Chad, and we'll talk to you soon. Thank you.